In this lecture, we will discuss how to approach a case of general weakness, that is a patient who complains of weakness, fatigue, tiredness and lethargy. First, we will consider a patient who has only weakness, no other complaints, no fever, cough, dyspnea or any such systemic symptoms, just weakness. When a patient complains of weakness, first look for anemia. Look for pallor in the tongue, conjunctiva and nails. If there is gross pallor, then anemia is the most likely cause for weakness. If there is mild pallor, mild degree of anemia may not be the cause for weakness, but it will be a definite contributing factor that needs to be corrected. If the patient is middle-aged or elderly, then weakness should reflexly make you think of diabetes. Ask for history of excessive urination and thirst, and check urine sugar and postprandial blood sugar. Feeling of general weakness is one of the common presenting symptoms of diabetes, which is often neglected till weight loss or some other symptom brings him to the doctor. So when an adult patient complains of weakness, always rule out diabetes. And if a patient is known diabetic, check whether it is poorly controlled and the blood sugar levels have gone high. Another important cause of general weakness is depression. If there is unsolved tension in the business or job or in the family, the person may present with general weakness. If other features of depression like loss of interest in activities, lack of confidence, insomnia or forgetfulness are not present, then it may be difficult to diagnose. But if clinically patient is fine, all investigations are normal, then always think of depression and ask about any tensions on the mind. These patients will need an antidepressant like fluoxetine or imipramine in addition to the general tonics. Another cause which is seen in recent times in patients of hyperlipidemia is statin myalgia. Many elderly patients and all IHD patients are now advised to take statins like atorvastatin or rosuvastatin. After few months of taking statin, some patients complain of severe weakness, feeling of heaviness and weakness in limb muscles with muscle pains. This is called statin myalgia. So if the patient complaining of weakness has history of IHD, ask whether he is taking a statin. The dose of the statin will have to be reduced or replaced by fenofibrate. Now we will consider general weakness where it is a part of a systemic illness. Patients of tuberculosis, malignancies, heart failure, either LVF or CCF, chronic renal failure, they usually complain of severe weakness. But then usually there will be accompanying symptoms. For example, in tuberculosis, the patient will have low-grade fever, cough, expectoration, hemoptysis or breathlessness. In LVF, patient has breathlessness, cough, chest pain or palpitation. In malignancy, there will be symptoms depending on the site of the malignant tumor. But in some tumors, particularly hepatoma, anorexia and severe weakness may be the only presenting symptom, along with hepatomegaly. In myxedema or hypothyroidism, patient has puffy face, coarse skin, husky hoarse voice and slow relaxation of tendon jerks. So the point is that we must ask a proper history and examine the patient thoroughly to rule out all possible causes of general weakness. If a cause is found, it should be treated along with the symptomatic treatment for general weakness. Lastly, we come to the symptomatic treatment of general weakness. First and foremost is your encouraging words for the patient. Encourage the patient to be active, to sit and walk in fresh air, gentle exercise, have fruits, fruit juices and good food. Prescribe a tonic containing B complex and other vitamins and minerals. If the appetite is reduced, prescribe a appetizer tonic like Activate or Bayer's tonic. Secondly, prescribe a calcium tablet or syrup also. In elderly patients, ginseng tablets should be additionally prescribed. For quicker relief and in severe cases, you should also give a course of 3 to 5 injections of B complex and 1 or 2 intravenous injections of calcium gluconate given very slowly. Elderly patients are greatly benefited by injection decadurabolin 25 or 50 milligrams IM once in 4 to 7 days for 2 or 3 injections. Additionally, if the patient is having any accompanying disease like diabetes or tuberculosis, that too should be treated.